DJ Leroy.
Night Watchman, how you doing, buddy?
I'm well. How are you?
Good, good. Another wonderful, of course, Monday evening in
hmm
NYC. What do you
hmm
think about that?
In
What's
Harlem. Even
yes,
better. Even better.
even better. And you know what? It seems like the weather is finally cooperating. What do you
Yeah,
think?
yeah. We're finally into a real, actual spring. Yeah.
How,
Um, um,
how, however, Night Watchman, I don't know. We're in the spring, but you know what? COVID is still here.
not to be messed around with. Yeah.
Another surge, as they say. They say our numbers are up. So you know what? I need to know what's happening in Harlem. What about you?
Absolutely. So we brought along a panel of experts, right?
We have indeed. We have indeed. You know
hmm
what? First person, she is a licensed clinical social worker, a
hmm
director of the CUNY School of Public Health and Harlem Health Initiative, inaugural initiative to address neighborhood service priorities, improve health, and reduce health disparities throughout Harlem. That could only be one person. You know that, Night Watchman. It's
hmm
Deborah Levine. Let's bring her up. Deborah,
Absolutely.
how you
Welcome.
doing?
Hi, thank you for having me.
Absolutely, absolutely. And you know what? Something now. Remember, Night Watchman. I'm originally from what? The BX. But this
hmm
person, yeah. Oh, you too, Deborah. I didn't notice. Ooh, yeah. Well, this other person is actually a lifelong Harlemite, or of she's a resident of East Harlem.
hmm
And whether it's fighting issues for the elderly, the physically challenged, healthcare, inequalities and inequities, she has staunchly worked towards change. She was the chief CERT 11 Community Emergency Response Team member, a volunteer organization developed by the New York City Emergency Management as the first responders in public health emergencies, terrorism, domestic disasters, and educating our communities on emergency preparedness. And Night Watchman, who could that be?
That is Carol Johnson. She's
Yeah.
also part of the East Harlem COAD and Harlem Emergency Network. Yes.
See, this is what we're talking about. This is what we're
hmm
talking about.
hmm
Now with this a final guest on the show, you know what? A Night Watchman. I hear he's been here before.
I hear that too.
I
Rumors.
hear that he's also at the New York City Department of Health
hmm
and heading up the Greater Harlem Chamber of Commerce's health committee. I guess that can only be a guy if you like Ethiopian food. You'll tap into him, and that's Mr. Padmore John. Padmore.
Good evening,
Welcome.
and good evening,
Welcome.
everyone. How you doing?
Good, good. So you know what, Night Watchman, let's get it popping right now.
hmm
So Miss Levine,
Yes,
please do tell us your journey. How did you end up there at the CUNY School of Public Health?
well, first let me bring greetings from the school and our dean and our entire faculty and students. For those that don't know, the SUNY School of Public Health and Health Policy is right on 125th Street, 55 West 125th. So we are a school of public health that is part of the community. Our goal is really to be not an institution in the community, but really part of the fabric of the community. And
Mm,
so it has been my honor and privilege to have joined the School of Public Health in February of 2020, right
mm,
as the pandemic was moving into New York City, and we
yeah.
went out in March.
Wow. Wow. That's right. Mm,
But our dean is a visionary and said, Deborah, whatever the community needs, we need to respond. We need to be able to use the resources we have to support community education, to work with community based organizations and associations in any way necessary to get culturally competent, linguistically sensitive, science based information to the community. So that's what we did.
excellent. Excellent. And you know what? I definitely have to know that I see you also in the community, sometimes participating in a number of forums that I say, oh, Deborah's here. So how do you decide which forums or which places that folks gather to get out your information?
So if you have more than 2 in a room, I am happy to be there. Very honestly, I am a daughter of Harlem. I owe everything that I do around social work and public health to my experiences in working in the community. So when community calls, I come. It's not really an option. So it's all about community education. And for me, any way that we are able to do that and support that is a mechanism for us to be able to strengthen our collaborations and our relationships.
Beautiful, beautiful. So Ms. Johnson, you know that you're a legend around here, right? Yes, and not simply because you're a lifelong East Harlem resident, but folks know about you. Folks know about CERT. So folks know about all the advocacy work that you've done in and out of the community. So please tell me about your journey in doing what you do and doing it so well.
Well, good evening, all. Thank you so much for having me on this forum. Who would have ever thought? Actually, I started out as a singer. I'm celebrating my 60th year as a performer. And, having traveled the world in the United States, performing for Padmore John II, opening for President Mandela, singing background for Aretha Franklin, Yolanda Adams, James Brown. Who would have ever thought that I would be doing what I'm doing today? But being born catastrophically ill and actually wanting to be a doctor, it led me into nursing. I became so ill, I knew I would not be able to finish my doctoral studies. However, after I got so sick that I could no longer perform and travel, I just sort of fell into emergency preparation. Say that I was so tired, but I went to this event, and that's where it sparked this new energy to get involved here. I knew because of my parents, being visionaries and my parents being advocates and dragging me to all of the meetings, and as a result, being at that march where Dr. Martin Luther King delivered his speech.
Wow.
I already knew what it meant to move in Harlem, what Harlem needed. And so that was implanted in me. And now in emergency preparedness, I never thought I'd be here, but I'm grateful to be here because I see now exactly why we are and where we are, the donut that we're in, the disparities, the redlining, and that somebody had to speak up.
Right.
And so that, led me to different volunteer organizations with a very loud, booming voice, because I figured you didn't hire me, so you can't fire me. So this is what we do. I'm happy to be there. This is where I've worked with Padmore John and Department of Health and Department of Health and Mental Hygiene as a result of that. So I'm grateful for the work that we do. We've got some really, really powerful advocates in East Harlem, and we are not finished. Matter of fact, we're just really beginning the fight. They haven't seen what we're capable of doing yet.
Wow. Well, thank you for that. And you know what, Padmore, I only knew you as a ball player, a restaurateur. I knew that you were an employee of the New York City Department of Health, but I did not know that how deep this stuff was going until I saw your anointing by Lloyd Williams. So please tell me about your role on the committee.
Yes, hi. Good evening. Thank you so much for having me here and having me together with two very powerful women, two very powerful speakers and activists, advocates for health within Harlem and further afield. I do want to just officially say that I'm here speaking not in my capacity as an employee of the Department of Health, but as a community member who has been involved greatly in addressing and speaking to health, the health needs. And I think, Carol spoke about it, and she doesn't know, but she inspired me a long time ago because I heard of CERT from seeing what the CERT team and Community Board 11 was doing.
Okay.
And I was on my community board. I was in the capacity of the chair of the health committee, and I heard of what CB11 was doing. I never had a chance to actually reach out to Carol, but I spoke to other members, and that's when it occurred to me that CB9 should also do this. So that's what, in my capacity as chair of the health committee, and eventually when I became chair of the community board 9, it's one of the things I wanted to make sure that we have the capacity to be aware of the different ways of how we should respond to an emergency, for us to be prepared, because a prepared community is a resilient community, and that's some of the key things I took away from Sam Carroll and CB11's, and because I know it's been a much longer, much more entrenched in the community than we have over here in CB9. Yes, but I think we are all, much like what Deborah was speaking to, we are all about partnerships. I think it's very important for us to realize, especially in the midst of a worldwide pandemic, that we cannot do it alone, regardless whether you're with any agency, any city agency, a community-based organization that is long-standing within the community, or as some of the educational institutions that we have that are doing so much great work. And I think it's a measure of making so many connections and partnerships and strengthening each other, recognizing where we have gaps. As Carol spoke to, we know that the legacy of racism and slavery in this country still impacts us today, and deconstructing many of the systems are what we have to ensure that we're capable of doing, and reconstructing it in a way that is beneficial to our community here and now and for the long term. So I'm happy to be here this evening with you all, and for us to be able to ensure that we're working together.
Excellent. Thank you for that. Deborah, please do tell me about Harlem Health Initiative.
Sure. Just also want to acknowledge Miss Carol's work. I don't know that she realizes how much she has influenced so many of us around finding our voices and being able to use that. And Padmore, you are an example of a true warrior. So thank you, because you make it easy for the rest of us by creating those spaces at tables where we don't always get to. So just wanted to acknowledge that for both of these warriors, how much they contribute to the rest of us being able to do what we do. So just to really answer your question, the dean was very clear. The School of Public Health is just 6 years old. And his vision was really that the institution is part of the fabric of the community and not just an institution in the community. And so we have done everything from participating in community boards 9, 10, and 11's community board meetings. We worked with these boards also to do the cannabis forum that we conducted with and worked with 2 weekends ago. It was great to be out there with you all doing that. We've also done work around and with the New York City Vaccine Literacy Campaign out of our school, working with community-based organizations and associations to give them the information that's science-based so that they can put it out to the constituents and the consumers they serve, to partnering with organizations like Harlem Congregations for Community Improvement to launch the Harlem Strong Initiative, which is a mental health initiative really looking at and addressing anxiety and depression, and the intersection of COVID. So we have been super busy the last 2 years, along with doing a series of surveys around knowledge, attitudes, and beliefs in Harlem and throughout the city, that we've been able to share that data with our community partners and elected officials.
Gotcha. Perfect. Perfect. And you know what, Night Watchman. Now you've been in Harlem for many, many years yourself,
Hmm.
and so did you know about some of these particular activities that were happening in the health space?
Oh, absolutely. Well, first of all, as co-founder of Harlem Emergency Network, which I have had the pleasure of working directly with Carol Johnson, we did a lot of activity during the pandemic. In fact, Carol and I, from late March of 2020 till about July or August of 2021, did a COVID report weekly, every week, throughout the pandemic, reporting on the local stats, reporting on latest information. We reported on disparity in delivering of services. When we were supposed to have testing and we couldn't find testing, or the Carol can tell you stories about going to the location where the testing was supposed to be, and there was no sign, and there are a lot of things that happened that we got a chance to see the ground level issues of health disparity. And Carol's also been involved with the East Harlem COAD standing for community organizations active in disasters. And
Mm,
that's an organization of people and businesses in East Harlem that got together after, I think it was Hurricane Sandy, to address how communities could respond. And so in those capacities, I also went through the CERT program as well. And so we've had the opportunity to interact with both the Department of Health and New York City Emergency Management on a number of different issues, including COVID, including HIV awareness. So there's a coalition of community organizations that really create a fabric that I would say is kind of a safety net in terms of helping us get through issues, even with health disparities. What Harlem always has is this really rich and vibrant network of community organizations that really keep it together. And I'm privileged to interact with people on that level, and really great to have this panel today of people who have really been warriors for health outcomes in Harlem and in New York City in general.
beautiful, beautiful. And Carol, please expand more in terms of what this present pandemic has revealed to you about this disparities in your community.
Well, first of all, I'd like to say I'm just honored to be on the panel with these two wonderful people, and that you guys, put it together. What it revealed was something that I've always known existed,
Mm,
but it's so different when you're actually staring down the gun of the barrel.
wow.
Or I should say the
Wow.
barrel of the
Now the
gun.
God.
You know the gun is there, but when you're
Yeah.
actually looking down that
Mm,
barrel, it's something completely different.
wow.
Um, and it's something that's existed, and it was now that was what you would call a pandemic. It
Mm,
redlining
mhm,
and putting us in these areas where you know that we will be the hardest hit, we will be the first hit, but we will be the last to receive resources
mm,
and
mhm,
the last to recover. And oftentimes in emergencies, whether it's a act of God, a public health emergency, a flood, a storm, or whatever, oftentimes our emergencies morph from one into the other. We never really go through a recovery phase. And
mhm,
that's one of the
mhm,
reasons why the East Harlem COAD began. We looked at the models from the like Hurricane Valley.
Mm-hmm.
Co-eds had already been in existence. We looked at that. We looked at the
Mm-hmm.
differences in the responses to the emergencies based on the community that was hit. When we
Mm-hmm.
saw a completely different response in East Harlem when we had the gas explosion, and on the lower east side,
Uh-huh.
saw the vast difference in this response. We
Wow.
realized that it was a community effort that would make a difference. And so at that point, we decided that we needed to put together a coalition of groups, of medical centers,
Mm.
community-based organizations, faith-based organizations, all of those voices that had been in Harlem for so long, but no one was listening to them. He said, if we pull them together and create a cohesive, rapid response, a coalition of involved individuals in the neighborhood. And if
Mm-hmm.
we all pull together and showed how this can happen,
Mm-hmm.
we would be
Mm-hmm.
much better off. And in working with the Department of Health and having been going to their meetings for years, and Department of Health and Mental Hygiene, and of course being involved with New York City Emergency Management, I had created all of these different contacts. And so we called them out, and they actually came in and joined with us and helped
Wow.
us build out our model. I am
Wow.
the disaster liaison for the group. And so, with all the different contacts that I had and inviting people in, we were able to now map out what it would look like for a rapid response to be able to get information out and able to get resources and everything that we needed. And so we hit the ground running during this pandemic. We have been activated since the beginning, getting
Mm-hmm.
testing sites, finding where the vaccination sites were. As Bob said, oftentimes the addresses were either wrong,
Mm.
there was no signage, and so that was my job, to get out in the community and make sure that these things were in place, and to get to the individuals, having had the ability, personally knowing some of the people that I could reach out to and say, listen, these addresses are wrong, you need to fix it. you know and so as a result of doing that and joining with the New York City VOAD, which is about 65 organizations strong, we were able to engage in so many different areas, getting information out for families where
Mm-hmm.
we have multi-generational families in
Mm-hmm.
one small apartment. What do you do if someone has COVID symptoms and there's 11 people living in a household and it's a 2-bedroom apartment?
Wow.
So we were able
Yes.
to get that information, get it out, pantries, whatever people needed, evictions, working
Mm-hmm.
with the homeless, whatever people needed, and it reached out to us. We were able to send them in the direction of what they needed to find.
Wow. Excellent.
And
Excellent.
I also think we have to give Carol her flowers for her Herculean efforts in delivering PPE, not only to Harlem, but also to your borough, the Bronx. And Carol is single handedly responsible for tens of thousands of masks and sanitizers to be delivered to people during this pandemic. And
Wow.
this is what I was saying,
Yes.
is that it's community groups that got not just the word out, but really delivered the goods, whether it be food pantries, whether it be PPE. All that happened on a grassroots level. It did not, happen. We did our best and we did interact with our city and state agencies, but the heavy lifting was done by community organizations and people like Carol, who tirelessly, delivered the goods for Harlem, Upper Manhattan, and the Bronx.
Wow. Carol, thank you so much for the service, for sure. But actually, all of you. And that's the one thing that kind of like I guess, surprised me. But why should it? In terms of this whole collaborative effort that you guys have, you all know each other because you've been doing the work. And good old Padmore, you mentioned something about something systemic. I thought we were in a post-racial society. Is that not the case? Tell me, man. Uh,
We we may be in a post-racial society, but the systems that were constructed prior to that still are entrenched, they are functioning, they are debilitating, and they continue to impact our communities. So,
mm,
whatever may have been said about what happened, the way we interacted with each other long times ago, these systems are still in place. I mean,
mm,
we know, and I think it's really important that one, what Carol and Deborah are talking about in terms of these connections. And first and foremost, when Carol call you to come to something, you gotta come. You're not invited twice, right? So you're like, I'll be there. But it's important because we see across America, we see across, as Carol was alluding to, some of the other tragedies and man-made and naturally occurring, that when a community is not well stuck together,
yeah.
it's easy for them to fall apart, right?
Hmm.
And I'll
Hmm.
give you really quickly the example of New Orleans.
Hmm.
There are two very specific minority communities that were very much impacted in New Orleans: the Vietnamese community and the African American community. To this day,
Wow.
some African American businesses, maybe 35% of African American businesses and individuals, homeowners, have not returned, right?
Wow.
And even some
Wow.
numbers have it even higher. The
Hmm.
Vietnamese population, within a year, almost 80 to 90% of them had returned. They
Mm.
were very close knit, well put together, and it was before the event occurred, right? They were
Hmm.
strong. So, and that was part of partnerships between businesses and organizations, and I think
Hmm.
that's what we have to get to. Yes, as the night watchman was alluding to, city and state agencies have a part to play, but it's also important that we build up our capacity as organizations, as community boards, as just informed residents that do realize the ways for us to be able to like knit a stronger relationship between our organizations, between the partnerships. So coads, coalitions, these are being supported now by more and more city agencies, from city and state agencies, which is very important. But we have to recognize that the way they are able to speak to very specific populations,
Hmm.
the way they're able to know the very specific needs of this particular populations, and the way to message to these populations are very important, right?
Hmm.
We have organizations from cities, certain state agencies, city agencies. They're gonna put things out in a way that the mass can read, can understand, right?
Hmm.
And sometimes that is on a high level.
Hmm.
We need to make sure that that message is now being conveyed in a way that maybe, because, and I tell you what, I do a lot of work in East Harlem, where Carol
Hmm.
is based, and there is a non-Spanish indigenous speaking population within here, right? And
Hmm.
non-Spanish, and they're from South America, Central America. And
Wow.
if we do not know about these populations, how to get to them, how to know what language we should be reaching them out into, or even the way to put things together so it makes sense to them from their perspective, I think that's really important. There's a growing and a very large Chinese speaking population in East Harlem. How do
Mm.
we make sure that the
Wow.
language, the information is getting out to them? In West Harlem, there's also a non Spanish speaking indigenous population. So we got to know who we are, and these community based organizations, these coalitions, these coads, even I think very important that Deborah is saying, how to help work with these organizations so that they can get the messaging out, how to refine it. We know they know how to get that stuff out there, but they need to get the information, and I think it's important. I know very well that the dean at the School of Public Health, for CUNY, he has been encouraging his team to come out and go over. We have been doing some of the same stuff here in East Harlem, and I think it's really important. I just want to make a slight change to us being aware of what is happening, right? For again, in terms of the climate change and climate
Mm-hmm.
crisis,
Mm-hmm.
I think that's something that we haven't often talked about. But we know that communities of color, um, marginalized communities, disinvested communities are the one that are most impacted by the
Mhm.
outcomes of climate change. But they're the ones that are least contributing to the problem, right? So so
Wow.
you
Mm-hmm.
we are the dumping grounds.
Mm-hmm.
This is
Mm-hmm.
where when it gets hot, when everywhere gets hot, we get
Mm-hmm.
hotter. And so it's important that we also, so that's one of the things that we're starting to do with the Greater Harlem Chamber of Commerce in terms of addressing the climate crisis. We're looking to have a symposium around
Uh-huh.
Harlem Week, being able to get that information out to partners to join us, and being also be ensuring that we are devising ways of mitigate, educate, and advocate, right?
Mm.
Because there are a lot of things that needs to be done. There are a lot of individuals that have suffered and that continue to suffer now because of the climate change, and we want to make sure that this is not another pandemic, a slow creep, as Carol said, a pandemic, right? Because there are different things that we have to do right now to try and prevent this from really turning detrimental to our community.
Wow. Wow.
I want
Powerful.
to I want to follow on with that because Harlem Emergency Network has partnered with the East Harlem COAD and We Act for Environmental Justice on the climate change issue. We're actually going to be doing a live stream on Saturday, June 4th from 10 a.m. to 12 p.m. talking about Harlem being ready for climate change. I'm going to officially invite Padmore, and I'll reach out to him, and we can talk about how we can involve you in that broadcast
Mm-hmm.
because it's really an all hands on deck issue. And these are the types of coalitions that are so important. We were really happy to start working with We Act, which is been one of the stalwart community organizations for many years, and we've been partnering with them. They got more resources than we do, but they have some great people, obviously, and they've been forward on that on the climate justice issue, and so we're happy to lend our voice and expertise and experience. And these are the types of things that we all need to do in order to address these systemic inequities. I also wanted to just talk about a couple of things that happened during the pandemic and make sure that we don't forget about these things. So one of the things we saw, allocation of resources in the early days. We all remember when they were setting up resources in Central Park, and they were setting up resources. They had the Intrepid, or they had a boat off of the pier, and so there were a lot of resources that were deployed downtown when the numbers were showing that we were really seeing the hardest hit areas being in areas like Harlem, especially in East Harlem and the Bronx. These areas when the pandemic was raging, and yet resources were being deployed downtown. And I want to say that our interactions with our city and state agencies, there were tremendous amount of people who worked at these agencies tirelessly against this pandemic. But we also know that there was a lot of politicizing at the top of these agencies. We had Mayor de Blasio's administration, Governor Cuomo's administration, and we know they didn't really play well nice with each other. And
Mm-hmm.
and we had to feel that those relationships had an impact on delivery of services to our community. And so we saw this the first wave was just trying to get testing in our communities, and then let's not forget, now that vaccines and testing are prevalent. You can get testing anywhere. You can get a vaccine anywhere. Let us not forget that in the early days of the vaccine rollout, even when we were supposed to have vaccines in our community, we had these situations, and Carol can attest to this, where we didn't even know the vaccines were in our community, and other people came from outside our communities to get vaccinated. And these types of the vaccine poaching, we were calling it at the time, these types of inequities don't happen by accident, that somebody from Westchester and Long Island can know that they can go to a location in Harlem to get a vaccine, but no one in Harlem actually knew that it was available. So, as we're now we have a new governor, we have a new mayor, and there's an opportunity for us to redress these issues, but it doesn't happen if we don't remember. And the biggest thing that we face in this country right now is what I call eracism, where we just kind of forget what happened and go on. Let's move on. And it's important that we document the inequities and bring these things out, and so that we can bring them into the light so they can be addressed.
Excellent. Yes. And Deborah, at the CUNY School of Public Health, certainly you guys are collecting data and actually sending this data, making sure that it's, let's say, utilized by the community. What are some of the findings that you've been, I guess, discovering in the course of your work as it relates to health disparities in our community?
So thank you for that. And let me just say, Padmore, if there's any way that we can support the work that you are doing with the chamber, please know you have my cell. So we are happy to support that work. One of the other things that I just wanted to also raise is that one of the things that the School of Public Health did was also work with our community partners, Ryan Center, National Black Leadership Commission on Health, HCCI, to move community members to get tested, vaccines, recognizing also that it was going to be our community partners that were going to help those that weren't connected to technology, that didn't know how to sign up to get those things. So we utilized students, faculty. We came in and volunteered to literally escort people to testing sites and to also get vaccinated. That's part of the role that this school plays in terms of boots on the ground. It's the only way that we can do this sort of community engagement. What I will tell you is that we already know in Black and Brown communities that we have already been impacted with what they call social determinants. Our dean uses the word social and racial inequities, call it what it is. So before this pandemic, we already knew we were impacted with issues around mental health, food insecurities, economic issues. The pandemic just sort of brought more light to this. We know that when other people sneeze, we end up getting deathly sick and having that level of impact. So really what the school has been able to do is highlight what the community has raised as issues and really help to supply the information. Where does the community members, what's their knowledge, their attitudes and beliefs about how they interact with not only the local government, but how they want to receive their information, where they want to receive it. Our goal wasn't really to be in the front of the room. It was really to supply that data, that information to organizations that had boots on the ground that could use it to rewrite their goals and their objectives for their grants so that they could get COVID money, support working in NYCHA housing, to get the testing word out, to get the vaccine education, to help set up those food pantries. That was really the role that the school has played and wants to continue to support. But even when we look at the survey data, what we are seeing is increased levels of anxiety, depression, people feeling extremely overwhelmed, not only with dealing with the pandemic for their own personal selves, but we're also talking about our frontline workers, the folks who are in our businesses, who are in our social services, who came in and continue to serve not only the members of Harlem, but the members of New York City. So those are concerning. We're seeing those rates go higher. People have heard, over the last year that rates of suicide in our young people are going up
Wow.
in Black and Brown communities. So we have a role and a responsibility to help create more platforms for our advocates to be able to get that word out and support them with the theory, the data to make those cases.
Mm, excellent. One thing, I guess what I heard in terms of the whole mental health piece, that's something that we really never really addressed in the Black and Brown communities. But you think that that is now, since we've had the pandemic and the lockdown, that we're seeing more evidence that that's a need that needs to be addressed?
Definitely. I think the emotional toll that COVID-19 has played in our communities around mental health, we're seeing rates of anxiety and depression going up by 3 times higher than
Wow.
the rates of 2019.
Mm,
And I think both Padmore and Carol will attest that we were already in a stressful situation in our communities. So when you are forced to have children at home having to be educated, but you still have to be a frontline worker and figure out how to navigate that on top of, in some cases, people having lost their jobs. There is just a more complicated, um, fractured system. And
mhm.
so it is because of these coalitions like what Carol is doing, what Padmore is doing, what Community Board 10 is doing, HCCI, Ryan Center, Black Health, all of these organizations are creating the safety nets. They are stitching together what is sort of the bigger picture, but being
Mhm.
there to catch those that, again, may not be connected to community-based organizations, may not feel like they have a voice, but also address things like stigma and discrimination and create spaces where people can really get the services that they need.
Wow, wow. So, Carol, well, so I'm hearing literally in terms of okay, mental health piece. I can't just put on my mask and carry on my day as if nothing else is happening. The mental health piece really can affect the whole of my well being. So, tell me about what you've seen there in East Harlem. Considering I do know that you guys were leading the city, I know, in asthma related incidents, but tell me about that.
Well, to be clear, let's start with the fact that communities such as mine have always been untrusting
Mm,
communities. And so generationally, we don't believe certain things are coming, and so we don't look for them. We
mm-hmm,
have so many things that are piled on through the years. Let's not forget all of the deaths that we suffered. People have yet to be able to even mourn their loved ones because so many people were dying around us unnecessarily,
mm-hmm,
because
mm-hmm,
people were allowed into medical institutions downtown. Medical institutions were opened downtown before they opened uptown. Mental health issues have always been an issue in our
mm.
communities. We
Wow.
fought and we fought and we fought for. I remember my parents fighting for that 25, I say about maybe 30, 35 years ago, about
Mm-hmm,
the
mm-hmm,
mental issues in our communities. And then it was because of the drug addiction, the heroin,
mm-hmm,
you know,
mm-hmm,
addictions and deaths that was taking place. So we've always had that issue. Now pile on a pandemic where
mm-hmm,
there's no one to talk to. There's
Right.
no place to go. And even when there were places to go, you still didn't trust the information.
Right.
When you knew that information was not being fed into our communities, people were at a loss. And that's where coalitions like ours come in, because people know us. So they would more believe what we're trying to tell them in terms of where to go, where something is. They knew we had already done the homework and found out that it was there. People were going out seeking situations that was taking place with their children, not being in school, not being able to play with their friends. And you're talking about kids who were already at a disadvantage, because they didn't have tablets to go, into schooling. So now they're really isolated. And so we saw that back in March, the co-ed had a mental health um, program for starting for the youth from 14 to 18. And those kids came in and they saw something different. You said families, even some of the parents asked to come, and it was only for the youth. But we allowed those parents to come in because we knew they were overwhelmed. That they're dealing with brokenness in their families. They're dealing with the sons are dealing with not having fathers at home. The single parents are at work most of the time, so the children are on their own, and they reach out to other people, sometimes unsavory characters. And now mother is really overwhelmed. What do I do? How do I pull my child back from that element? And so we've been doing a lot of work in that capacity. So we've done a few mental health seminars. We have another one coming up, I believe, in June. We're going to do one, East Harlem tutorial program. We've been working very, very closely with them. But it's going to come a time when eventually everybody's going to have to learn how to breathe. Somebody has to tell them it's okay for you to breathe. It's okay for you to settle down. It's okay for you to go through what you have to go through. Most importantly, I'm listening. And we don't have a lot of listening ears to hear what people are going through. But the struggle is real.
Yes.
And, now when we're looking at, as I said, the multiple deaths that I know I stopped counting, well over 100 people that died from COVID.
Wow.
We have not yet mourned that. Put that on top of all that we were going through before the pandemic started. And so now it's a matter of reaching out and getting the messaging out that there are seminars, there's events taking place where you can come and you can get that help. And if I can add one more thing, Padmore said something very, very important about that messaging, where the language, it took months for them to understand that people speak different languages and you're not translating anything into any of those languages. You're getting people who were translating information in traditional Mandarin languages instead of getting somebody, as Deborah said, boots on the ground people who could translate it in a conversational way so that people could understand what was going on. And so many times the messaging had to be pulled back and retranslated because people were saying we don't even know what they're saying.
Wow.
It's like we speak Spanglish in East Harlem. And we want to translate something into what is the Castilian? Even when I was in Spain and I said "que hora es," they said what? And then I said, "Oh, that's right, que es la hora," like they didn't know the difference. But I mean, when you look at it, that no one could understand the wording. And then it took months before they figured that out, even though we were saying it all along. So it's always in the messaging and the mismessaging and the constant leaving out of certain communities so that they don't get the message at all.
Yes, yes,
And that's
indeed.
where we come in.
Hmm. Gotcha. Well, one of the things, and Padmore, I know you probably can comment on this. I see, of course, the North River Sewage Treatment Facility, which is, of course, WEAC is a response to that, but also the long bus terminal where the buses, yes, that continue to
Mhm.
idle there. So, I mean, literally, I see every community has had their response to some of these physical morbidities, right, that have really caused harm to the community. Now, I understand that the North River Sewage Treatment Facility, the former, that we're seeing some repurposing of that. Is that correct? Tell me
Yeah.
about that.
Well, in the sense that one of the key things that they're trying to do is to decrease the use of electricity. The gas that is coming out from the cleaning of the water, the whole process, that can be utilized as an electricity generator, and
Mm,
that in turn would allow the plant to decrease the use on the grid, even to the point where it may be able to give electricity back to the grid. And so that's really important. That's the way we should be considering how do the different ways we as a community can become less reliant on the traditional forms of electricity, because we know that this is causing such a detriment to our entire
uh-oh. Did we just lose
point.
Padmore?
Yeah, he's there.
Thing that's
Padmore, we
Hello.
had some difficulty. Repeat that last part again, please.
Sure. Okay, sorry about that. I said I just wanted to go
That's
back
right.
really quickly to the point of mental health. Um, it's a very serious problem, right?
Mm-hmm.
And it's manifested in so many different ways. Substance use. We're hearing young people, and it tends to be that children of color are more likely to take their lives. We have seen some of the disparities in that as well. And this is just more or less a recent phenomena where we're seeing a lot more what's been happening in terms of individuals and how they're being impacted by some of the challenges that they're facing. Um, I think it's really important that as we are thinking forward of methodologies of support, that we have to think in an untraditional way, and that was part of the problem initially, because as Carol was saying, when the messaging is coming in from some of the official channels, it's very
Mm-hmm.
hard to accept from communities that have been on the outside looking in for so long. There's that mistrust.
Mm-hmm.
So it's important that even as we're looking for solution strategies, that it's not in the regular office and in a sit down situation to have a conversation with a mental health expert. We should think of it, and there are different wonderful young doctor from Colombia having conversations with in terms of how we may be able to do this. Non-traditional places, restaurants, barbershops, group sessions where people can have just a conversation and opening about what are some of the things and what are some of the challenges that they're facing mentally, behaviorally, recognizing that this whole concept of taking care of ourselves begin physically, mentally, emotionally, spiritually. We as a people of color, that is the way we approach a lot of our things, and I think we shouldn't do this now in terms of for recovery from the pandemic, but also moving forward so that we are not succumbing to these type of activities in the future, where we build up comprehensively the support for each other, that we're able to recognize their physical needs, that their mental, emotional, spiritual needs that we need to address. And it is by building this trust through our coalitions, to ongoing conversations, to partnerships, to recognizing that I cannot be everywhere, my organization cannot be everywhere, but how can I work with another organization who can fill in this gap, or I can take from 1 to 3, but I know 4 to 5 is needed for this particular client. How can we make sure that we have this connectivity ongoing? So I think it's really important that we do have a focus on mental health. We see what's happening in the opioids, and some of these opioid settlement that's coming down. We should make sure that some of our this funding is coming to our communities, which have been so negatively impacted. We know that nearly everywhere fentanyl is in everything, right? For the time when you're thinking you're taking, you're smoking something or whatever, next it's in fentanyl, and I think that education needs to be out there. So our young people, in general public, they know that this is something that they may have to be aware of. Test the drugs that they're using, making sure that there's no fentanyl in there before use, making sure that you're connected to a support system when it's time for you to be doing these things, because it's important that you do have someone there with you. And I think that's this whole concept of it takes a village. Now, it's not just to take a village to raise a child, it takes a village to look out for the village. And I think it's important that we get on that level for us to continue to build these coalitions, these relationships, these partnerships. There's no way we can do it by ourselves. And I appreciate the fact that you're able to bring us all together to continue having this conversation. Carol and Deborah, I know we'll be working very, very closely moving forward. We want to strengthen and grow as we support our community.
Excellent. Night Watchman, uh, give us some thoughts, and then take us home for final remarks.
Well, yeah, we're in the final stage, so I think we probably want to give each of our guests a chance to just give us some final words.
Oh yeah, absolutely. Deborah, do tell. Tell me about what's upcoming for CUNY's School of Public Health in the coming weeks and the summer. What do you see?
So really quickly, we are in the launch phases of the Harlem Strong Initiative, and I encourage any of our community-based organizations, houses of worship, associations to reach out to me. Happy to bring more of us into that coalition work. We also are working with Columbia University, the Department of Health, and the Department of Emergency Management to launch the Pandemic Response Institute next week. So please check your mail, both Carol and Padmore, because we need to have your voices at that table. And just know that we will be in the streets and supporting the Harlem community. Anyway, you have my email address, you've got my cell phone number. Let me know how we can continue to partner to ensure that we're centering community.
Excellent. Carol, some final thoughts.
Thank you, Bob. Thank you, Padmore. Thank you, Deborah. And who did I leave out? Curtis. I'm so sorry. As I said, the fight continues. We have some programming planned, as Bob spoke of the June 4th event with We Act and Harlem Emergency Network, co-ed. We have a just sit back and get pampered day coming up on May 14th. And that's going to be from 10 to 12 at the East Harlem Tutorial, where we'll just have a chance to sit back. All ages are welcome. Relax, do meditation, do origami, have something to eat, just chit chat, just get out, amongst your neighbors. And we have a few things coming up in September, which is National Preparedness Month, Emergency Preparedness Month. So we're going to be out there, and you'll see us. And as things come up, we would love to integrate with you, Deborah, and certainly Padmore. We will definitely be working with you in the near future. Thank you so much for this opportunity.
Excellent, Carol. A blessing for sure. Padmore, what's your final thought here, buddy?
Thank you so much, first and foremost, for all that you have been able to do. We just wanna. I think it's important for us to recognize that what we have done, what Carol, what Deborah have been doing has worked, right? It has made a difference.
Yes.
Trust me, in the lives of many, many people in East Harlem, Central Harlem, West Harlem, even Washington Heights and Inwood, it has made a difference. And I think we need to continue to go on that pathway, that we strengthen those relationships, strengthen those connections, that we advocate together, right? And that we are aware of what our the key and most important challenges are. And we also, as we're recovering not just for now, right? Because if we think of one of the biggest challenges that we're facing right now is housing and the impact that housing has on health. When the Federal Housing Act was passed in the 1920s, 100 years later is having an impact still. Right.
Yes.
So when we're thinking about recovery, what are the things that we're doing right now to be helpful to our communities that they need it right now, but also 100 years from now, so that we're not in this situation all over again? Thank you so much, Night Watchman and DJ Leroy, for all that you do. I know it's constantly in your wealth of knowledge in terms of bringing these topics out. We appreciate you all for the using your platform and your medium in this way, and we continue to look to be supportive and grow as a family. Thank you so much, all.
Thank you. Night Watchman, take us home.
It's Soul Lounge Prime Time. We are live on WHCR 90.3 FM, the voice of Harlem, on Monday evenings at 7 p.m. And you can find us on YouTube and Facebook at 8 p.m. streaming live. Please like and subscribe to us on those channels and come back every Monday for the best in what's going on in Harlem. Thank you for joining us.
Thank you all. All right.